Hello everyone, I'm Dr. John Quinn and welcome to another edition of Quinn It to Win It. Today we're here to talk about basketball. It's one of those sports where you absolutely have the body moving in different planes, left and right, forward and back. It's fast and it also goes vertical. So now you have athletes that are moving in different planes and they're up in the air and the body has to receive that load when they're in the air as well. So in basketball, we have a lot of different types of injuries. There's definitely collisions. We talk about concussions all the time. Believe it or not, in women's basketball, head and face and concussions are the #1 reason for athletes to lose play. For men, it's ankle sprains. On both lists though, it's definitely ankle injuries and knee injuries. One of the most common knee injuries is something called jumper's knee. Many times if you've watched players play or even seen your kids play, you'll see that they'll have some type of tape or some type of band underneath the knee. What that's done is that's basically taking some of the pressure off of the tendon that connects to the kneecap to the lower portion of the leg. That's a Band-Aid. That's so that they can go out there and they can try to get through the day in regards to playing practice or through a competition. It's not the solution though. These injuries usually to the patella tendon is normally weakness at the hip, weakness in the muscles and the quadricep muscles and the hamstrings, and if these muscles don't have any type of symmetry there, you'll actually have a lot of pressure and abnormal stress on that patella tendon. And that tendon's taking a lot of stress when they're pivoting back and forth and they're going vertical and then having to receive the body weight when they come down. Physical therapy is absolutely excellent for treating that. We do a lot of different type of techniques, both manual to get rid of inflammation if it's there, and we also do a lot of strengthening in different planes to try to open up the hip where usually that source of weakness is and get those muscles firing appropriately and get the kids back on the court. Now let's talk about ankle injuries. You can't avoid someone coming up in the air and someone hits them in the air on an offensive defensive play and they come down funny on the ankle. You know what? If they're going to land awkwardly on there, it's going to cause an ankle sprain. Players usually will injure the ankles when they're actually moving back and forth on the court. So they're going in one direction, cut real quick to the other, and guess what? The ankle rolls, they sprain the ankle, and they're out on an average of 20 days. That's a long time. And later on in the season, it could mean they're out, and they're not going to be able to compete in some of the big games. One of the most important things is not waiting for the injury to do something about it. And that becomes the most common thing that happens at physical therapy and when we see patients come in, especially athletes that are competing at the high school level. We want to get it before it happens. It's the prevention. At Moriarty Physical Therapy, we do selective functional movement assessments. We're looking at the entire body and we want to see where those weaknesses are. We want to see where those abnormalities are, where a lot of these injuries take place. Do you know that the average injury that takes place in basketball has the athletes out of competition for about 20 days? 20 days. That's almost 3 weeks where they are not competing. That can end the season for an athlete if they're competing at the end of the season when they're competing for sections, when they're competing championships and trying to go to states. So remember, you don't wait until the injury takes place. Be proactive as an athlete, train beforehand, and absolutely use us as a resource to find those areas of weakness. So remember, be safe, train smart. I'm Dr. John Quinn, and I'm here to help you Quinn it to win it.